some of the symptoms, and it's not exhaustive, but some of the symptoms depend. It depends on the type of disorder as well. That have been diagnosed, if you use diagnosis, because someone with dissociative disorder may have problem including, memory loss, which is called amnesia. Problem with orientation of time, place. You have that, with many psychiatric conditions, even, not only with Alzheimer, but also many other psychopathology. And they have problems with even personal information. As if, inverted commas, they have a split personality or multiple personality anyway. And some of them have a distorted sense of identity. Some people, you see it in many films, I think, not many, but, where people don't know who they are. They're totally, completely, alienated from the past anyway, And when they live in the present, they don't know who these people who are close to them are, even if they're married and so forth. So the sense of a distorted sense of identity, a sense of, not only derealization with the self, but also a sense of detachment from the physical reality, and the emotional dimension. There's also a sense of make-believe, experiences stress-related problem, which is associated with some interpersonal relationship. Could be at work, could be at home, and so forth. And this is sometimes accompanied with depression, anxiety. And when you have depression, as you know, all depressed patient is potential suicidal risk, which means suicidal thoughts are present anyway. However, some individual would present with problem of movement, of kinetic, I think, this movement of sensation. Some involve with seizures, convulsions, paralysis, loss of sensation, all part of the body. So, however, some of the symptoms may have organic causes, there may be some neurological, deficit, but they cannot sometimes be explained. But something they don't have any organic, some of them do, some of them don't, Those who do not have organic or any neurodegenerative problems or neurological deficit, it cannot be explained by Western medicine. So if it's not, what it isn't. I've come across many patients who have done all the different tests you could think of, blood tests, physical tests, scan, and there's nothing that could be identified as something neurological or physical. So if it's not, then it could be either psychological or spiritual. So sometimes, like I say, medicine do not have the answer for this. In fact, medicine doesn't have answer for many things. Because it's all about trial and error. It's all about experimentation. It's all about giving you this drug, you get better, or do lots of tests and find out, some of your, doctors are not God anyway.